I get a lot of questions about shoulder problems. And, how do I know if I have a bad shoulder problems? Can I rehab this myself? Do I need to go to a physical therapist? And, you're the person that I wanted to bring on to talk about this because you've taught this for over 20 years. So, Chris, what are your thoughts on this? If somebody has a shoulder problem, when do they need to know if they need to go to a physical therapist? Is this something they could take care of themselves? What do you think?
I think that's a great question. So you nailed it. I've been practicing 20 years a trainer. And one of the things is that I got to say is I don't know everything, ever will, but my expertise and usually specialty is the spine. But I do see a lot of rotator cuff problems, both trauma, surgical, and the like. So I think the big thing is recognizing something is going wrong. It's not right. And it's lasting 2 or 3 days. Now, the pain typically is in the front of the shoulder or on top. But usually with the rotator cuff, Joe, we see problems that usually falls, trauma, or some kind of, incident. Like I remember doing this. I remember the dog pulled on my leash or did that. But the pain can also develop posturally. So if someone has sitting at a desk, they're sitting for hours on end, they're not stretching, they're doing their thing, and they have pain in their shoulder, they need to do what? They need to ice it and recognize it, not do heat, not stretch it for 24 to 72 hours, and then really try to say, okay, what are we doing here? Recognizing, you said earlier, if it is rotator cuff, you definitely nailed it earlier. We want to avoid overhead activity. So overhead will typically cause pain. And if it's not getting better within a week, I think you really need to see somebody, whether it be a physio, whether it be a doc, whether it be a chiropractor. Even the personal trainers listening out there can help by saying, okay, we're going to stop overhead movement. We're going to try working on below the chest and try to give it a rest is the first line of defense.
Yeah. You mentioned below the chest. What do you think of the decline bench press, which I see personal trainers doing? And that's one of the reasons they do it is, it's put less stress on the shoulder. What do you think of decline presses?
My thoughts are no. You're still putting pressure through the anterior deltoid. I mean, obviously, you're working different fibers of the pec. So I'd say no, definitely stay away. Yeah, definitely.
I would agree. And the personal trainers, I think, have a unique challenge in that they see people who they most likely won't have any information from a doctor or from someone like yourself. And so they're thinking on the fly and they know the more vertical they push, the more shoulder. And so let's go below the chest and let's see if that is putting less stress on the shoulder. And I would agree. Yeah, it's still working the shoulder. If you're pushing, it's anterior deltoid, right?
Exactly. And I think a general thumb for the audience out there who's your average Joe, who's the average Jane, and maybe the personal trainers listening, which we hope is listening to your podcast, which I'm love to see more of, is that we want to avoid overhead, but then side raising or abduction, known as side raising the arm. Classic involves the supraspinatus and medial deltoid. Those two muscles are involved typically in that problem. So I'd say that's a way of recognizing if someone has pain there, there's probably a sign that we need to stay away from that activity and not do those kind of working out.
So shoulder presses are out,
Yep.
lateral raises are out, even with a machine.
But typically the classic rotator cuff is supraspinatus because that's a weaker muscle. It's biomechanically weaker in the research. It has poor blood supply. And then the medial deltoid, but you can't forget the pec. You're right. And then the last that I've seen in my career, Joe, is typically infraspinatus and teres minor. Your rotators, those are last involved. They're stronger. So if someone does behind the back scratch test, what does that tell you? Well, it tells me that can they do it? If it's pain, well, where's the pain? If it's in the front, it's still going to be the pec major, or it could be subclavius or subscapularis. But I'm not as concerned. It's that side raising and overhead motion, totally. And extra rotating the shoulder, which is like reaching back for your seatbelt or reaching for that like throwing a baseball. That's a definite sign that something the rotator cuff's involved.
What are some exercises people could do, to strengthen these rotator cuff muscles? Like you just said, they don't get a lot of tender loving care in the gym. We do a lot of presses, we do a lot of pull downs and pull ups, but what are some things we could do to work those rotator cuff muscles?
Yeah, it's a good point. There's, as the audience listening, for those trainers listening, and then the non-trainer, the average person, there's 4 primary muscles of the shoulder, the rotator cuff, the sits muscle, they call it, supraspinatus, infraspinatus, teres minor, subscap. I'd say the biggest thing what you do, if everyone's taking their arms by their side and actually holding your elbow about 90 degrees, you taking your band, you can actually pull it apart. That actually works your external rotators. That's one thing you want to do. Another exercise, which is simple, you can use a dumbbell or a TheraBand or a tubing, is doing rows, which are pulling the band towards your chest like you're rowing a boat. That works those middle back muscles that are weaker, that are elongated. And then my other that I really like are the pull aparts. The taking the band and pulling it apart like you're ripping open a package is, if you can see me in the camera, but also listening to my voice, is pulling the band or resistance works the posterior deltoid, which is a small little muscle on the back of the shoulder. Those are my three that I really like that are easy to do. Or if you don't have tubing and you want to get even simpler, take a can of soup or a 2-pound soup, or 1 pound, usually 1 pound, lay on your side and raise your arm by your side with your elbow bent. That works the external rotators as well. That's another way of doing it functionally as well.
Yeah. I see sometimes people in the gym and they'll take some dumbbells or some weight plates and they'll essentially do this or externally rotating like this. And you know, it's funny, even I do this right now. If you're listening to it, you can't see me, but my right shoulder clicks a little bit when I do that. But if I got a cable machine and I'm rotating out like that, then I don't have that issue. So yeah, I think you got to find that motion that works well for you. When I went to the gym this morning, again, I see a lot of people doing shrugs with, weights, dumbbells. One of the things that I started doing a while back is I'll get on that seated tricep machine and I'll pick a weight that's appropriate for me. And I'll basically kind of sort of lock out my elbows, not completely, but then I'll depress my shoulders. I'll do shoulder blade depression. Do you think does that help the shoulder rotators?
Oh, without a doubt. That's a great point. So for those listening, and obviously Joe and I are showing and talking a little bit and visually seeing, you want to avoid working your upper traps. The traps are this big, large muscle goes from your neck to your basically base of your spine, and your upper traps are meant to be stretched, not strengthened. So doing shoulder shrugs is like me drinking decaf coffee. Can't do it. I need regular coffee. So I'm trying to say you want to avoid shrugging the shoulder or doing shrugs. And Joe nailed it. You want to do depression, which works the bottom of the rotator cuff. For those looking at the computer, you can see back in my little picture here, it's working the bottom of the shoulder blade. And the bottom of the shoulder blade is where everything attaches, the low traps, the rhomboids, and those little muscles around that work and need to be strengthened, which help with posture. So depression exercises, retraction exercises, pulling down are what we need to do. You're right. You nailed it. That's perfectly right.
Besides the pressing and the bench press again, are there any exercises that you would say just don't do them? The risk outweighs the benefits.
Yeah, that's a great point. Is shoulder overhead pull dumbbell pullovers. You're on a bench. And for those listening, you're on a bench, you're lying on your back, and you've got a dumbbell in your hand, and you're trying to pull it over your head and then come up towards your chest. One of the worst exercises you can do, and the reason is it puts a lot of stress on the front of the shoulder. For those who have either a labral injury or maybe had dislocation or had arthritis, it just puts a lot of stress in the front of the shoulder. So that's one. The second that I used to teach, and I admit, my fault. I totally did not understand the biomechanics and the physiology and the reasoning is upright rows. I said, oh, bigger traps, right? Big traps. Well, doing upright row is taking a barbell or a dumbbell and literally kind of gliding up your chest towards your chin. It maximally places stress on the rotator cuff and the capsule and the ligaments at end range. So is it safe? No, but I mean, why do you need to work your upper traps? So there's the give and take there. So those are the two that I stay away from. And really the third, Joe, and the audience listening, is anything end of range. End of range meaning beyond what it should go. Don't push it to an extreme, beyond a tethering, just a light pull. I'm talking end of range exercises I stay away from. Those are my three kind of go-to, those two and the other piece of advice.
That's an interesting point you mentioned, end of range, because in the world of personal training, we hear range of motion, work through
right.
Full range of motion all the time. And, while that's fine, but when you get close to your end of range of motion, that's when we tend to get into trouble. So, stop before you get to that point.
Exactly.